Effective Preceptor Series. The Hidden Curriculum. What are you teaching? While the formal curriculum, such as the APGO objectives, are well recognized, the hidden curriculum is unrealized and often provides ad hoc and opportunistic transmission of implicit beliefs and behaviors. It comprises those messages sent to the learner about culture, customs, rituals, and informal rules of our profession. It is a part of the socialization process of the institution and the faculty. The hidden curriculum can have both a positive and negative influence. Here are some examples. When you make comments about how great it is to see your patients improving, or praise the patient who has quit smoking, students may adopt this positive professional behavior. If you leave clinic on time to watch your child in a play or other activity, the importance of incorporating lifestyle in our profession is obvious. On the other hand, when medical students hear preceptors complain about the high cost of malpractice or the lifestyle of a practicing obstetrician, the hidden message, no matter what is being taught formally, is that the student might want to consider a different specialty. If a student witnesses the negative reaction or disapproval of a preceptor when faced with a patient who needs a blood transfusion but refuses, they may incorporate this into their own professional behavior. The hidden curriculum is not unique to obstetrics and gynecology. Research in curricula ranging from mathematics to continuing medical education shows that it is pervasive. In the medical world, we often hear comments such as, "He acts like a surgeon," or "That's how family physicians are." Such statements are generally attributed to behavior and attitudes that are not part of the formal curriculum. In what ways does the hidden curriculum impact learning? The hidden curriculum functions covertly in several aspects of obstetrics and gynecology education. Professional behavior and attitudes, assessment, institutional policy, and allocation of resources. Let's look at some of these individually. Professionalism. While most medical schools offer biomedical ethics courses, it is clear that such courses are too brief and too abstract, therefore make it unlikely that professionalism is learned. It is much more likely that day-to-day exposure in the clinical environment has a greater influence than the formal curriculum. Hidden curriculum messages from preceptors and faculty play a significant role in defining our profession to the medical students. If students believe that obstetrics and gynecology is incompatible with a successful marriage and a satisfactory family life, we need to check into the source of this misconception. It is definitely not from the formal curriculum. Assessment. Since medical education at all levels is now outcome-based, we often find that assessment drives learning. What we assess sends a message to our learners about our priorities. However, there can be a divergence between the formal curriculum and the hidden curriculum. Our formal objectives and outcome measures may suggest one message, while what is emphasized in the surgical suite or clinic suggests another. Some preceptors may actually point out this discrepancy, but more often than not, it is conveyed in other, more insidious ways. In addition to patient feedback and satisfaction surveys, nurses or other healthcare providers are often involved in 360-degree evaluations, and these can be affected by the hidden curriculum. The institution. Policies and allocation of resources are two of the most visible components of the hidden curriculum. While written policies demonstrating strong support and appreciation can affect staff, hidden messages are much more likely to impact their attitudes and behavior. Similarly, resource allocation reflects the institution's values. Does the dean's discretionary fund help support teaching efforts, including the preceptor program? Our community-based preceptors provided the necessary tools to successfully meet their mission? Here are some positive ways we can use the curriculum. Express satisfaction with patient encounters. Engage in a professional and friendly interaction with all staff. Show enthusiasm about your teaching assignments. Integrate professional and personal life. Demonstrate quality and collegial interactions with subspecialists and colleagues. Appreciate that there may be more than one right answer. Medicine is complex. Here's how we can avoid injecting negative messages and influence into the hidden curriculum. Stop complaining about workload, the cost of malpractice, and the number of patients. Do not make disparaging remarks about patients, healthcare team members, or other students and residents. Remember to take time off for family or self-care. Do not ignore patient concerns. And don't skip mid-rotation evaluations or cancel scheduled meetings and lectures. When supervising or teaching, we need to acknowledge that we may unwittingly make comments or do things that cast a shadow on appropriate professional behavior. If we speak disrespectfully with a colleague or about a colleague, it sends an inappropriate message to students that this may be acceptable behavior. These types of interactions often cause internal conflict in medical students, confusing them about appropriate behavior and possibly teaching them unprofessional behaviors. On the other hand, we should embrace and utilize those times when we can transmit a positive professional message.